Hello there, this is Dr. Mintz. This is a relatively uncommon disorder known as Opll. That's ossification of the posterior longitudinal ligament. It's associated with calcium pyrophosphate deposition disease and ankylosing spondylitis, and is characterized by these thick areas of ligamentous calcification, even ossification, which extend 2 or 3 or more levels in typically the cervical spine is the most commonly affected level, and here you see it in the cervical spine, and it's usually most prominent at about the C3 through C5 levels, which is the case here. Here you can see some disc degeneration with narrowing of the disc space height at C5-6 and C6-7 with this posterior ossification of the posterior longitudinal ligament, which is a little different than the typical osteophyte that you see occurring bridging between two adjacent levels. Here you have narrowing of the disc space at C3, C4, indicating disc degeneration. This lucency here is a degenerative cyst in the vertebral body, as is this one, and these are similar earlier degenerative changes, and you can see they are mostly juxtaposed to areas of severe disc degeneration, which is common. That is, these areas of demineralization. But this is classic for Opll, ossification of the posterior longitudinal ligament, and as you can see, you get a hint that this is really narrowing the cervical canal considerably and likely compressing the cord, and that becomes much more apparent on the axial images, and here we are now getting down to that level. And so the cervical spinal cord lives in here somewhere, so at best it's flattened, and since this develops over time, the cord somehow compensates for this process and retains most of its function, but there's a point of diminishing return, and this can become very crippling. So, ossification of posterior longitudinal ligament. Let's go up a little bit higher here. And we see mastoid air cells on each side. We see the cochlea, which is the auditory area, and the vestibular apparatus over here. Cochlea and vestibular apparatus. And then here is the internal auditory canal where the 8th nerve, which is the vestibulocochlear nerve, is located. These are the sphenoid sinuses. They are located in the sphenoid bone. This is part of the temporal bone. This is the petrous portion of the temporal bone. And then it's above that level that you have the squamosal portion of the temporal bone. And let's go to a coronal plane. And here you can see these degenerative osteophytic spurs on both levels here. This is 2, so this is C3-4, particularly C3-4 in this patient. And then C5-6, which is generally the most affected levels with this osteoarthritic process compared with any other cervical spinal level. C5-6 is preferentially involved. Okay, and here you see those areas of ossification. So the Opll, the ossification of the posterior longitudinal ligament, is present dorsal posterior to the vertebral body. So here are the vertebral bodies, and as we move more posteriorly and get out of them, we see these sheets of bone like this, which is Opll, ossification of the posterior longitudinal ligament. Look back at the sagittal. Here's the temporomandibular joint. Here's the external auditory canal. Here's the styloid process. Here is the hyoid bone, which is at the level of the larynx, and here's a calcified ligament, I believe, yeah, right here. Stylohyoid ligament calcification, just a normal variant more or less. Here's the epiglottis. Here's the vocal cords. Here's the tongue base. Here's the uvula, the midline flippy thing in the back of your throat when you yodel or otherwise open your mouth and vocalize. You see that kind of very clearly depicted. You don't have to vocalize though. It should be there anyway, but it shows up better when you vocalize. And here's the thyroid cartilage, partially calcified. And here is cricoid cartilage here. And here is arytenoid cartilage. And these all combine to form some of the skeletal structure of the larynx. The epiglottis flips down when we swallow. We swallow, the tongue moves back, pushes down on the epiglottis. It flips like a toilet lid over the entryway to the larynx. So it's, instead of going up like this, it folds down like this, and that creates kind of a funnel effect here and here, where all the food bolus that we're swallowing goes into the upper esophagus. So it creates a funnel directing all the swallowed food into the upper esophagus and closing off the airway, therefore protecting the airway. And this soft tissue at this level reflects the vocal cords. Okay, Opll, ossification of the posterior longitudinal ligament.